Have you ever noticed a subtle shift in your mom's eating habits? Perhaps she's leaving half her meals untouched, a stark contrast to her lifelong love of home-cooked dinners. Or maybe your dad, the one who used to walk miles every day without fail, now struggles to rise from his favorite armchair. You see changes, quiet, almost imperceptible, yet deeply unsettling, in someone you cherish. Maybe it's a weight loss that seems to be happening too quickly, despite their regular meals, or a level of tiredness that no amount of rest seems to cure, a fatigue that settles deep into their bones. Don't dismiss these changes, because I'm here to tell you, from years spent walking alongside families like yours, these aren't just mere signs of getting older. They can be critical warnings, soft whispers of time itself, signaling that your loved one may be entering the final year of their life's journey. It's a tough truth, a reality I've faced countless times in my decades of elder care. We often comfort ourselves with the notion that the end comes suddenly, like a storm out of a clear blue sky. But the truth, the delicate and sometimes painful truth, is that our bodies, even in their frailty, often try to communicate with us. They send out subtle signals, sometimes months, even a year in advance. And understanding those signals, it can be the difference between a peaceful transition and one filled with the sharp pangs of regret. So, if you've observed those changes, those whispers in the everyday moments, please, I urge you, don't ignore them. They might be telling you something profoundly important, something that requires your immediate attention and your deepest compassion. In my years as a geriatric care specialist and a speaker on senior wellness, I've seen families caught off guard, missing those early signs, often attributing them to the general process of aging. The consequences, regret. The deep ache of, if only we had known, if only we had more time to prepare, to create those last precious memories. That's why I'm here. In this article, I want to shed light on 5 critical signs that often appear in the year leading up to an elderly person's passing. Recognizing these signs early is not about dwelling on the end. It's about empowering you to provide the best possible care, to cherish every moment, and to ensure that your loved one's final chapter is filled with comfort, dignity, and peace. I encourage you to stay with me until the end, because what you'll learn here can help you navigate this delicate phase with greater clarity, compassion, and preparedness. 1. Significant weight loss. The body's quiet retreat. Think back to the last time you hugged your mom. Did she feel a little more fragile? Have you noticed her clothes hanging a bit looser? Perhaps her favorite dress, the one she always wore for family gatherings, now looks a size too big. These subtle changes often begin with a belt that needs tightening, clothes that suddenly seem too large, or a once hearty appetite that starts to dwindle. Many families, in my experience, dismiss it as just another part of growing older, but the truth is, unintentional weight loss is rarely a benign sign. It often signals that the body is no longer absorbing nutrients as efficiently as it once did. Muscle mass begins to decrease, and essential bodily systems start to slow down. While some muscle loss is a natural part of aging, when it happens rapidly and without conscious effort, it's a signal that something deeper is at play. The body might be struggling to digest food properly, or it may no longer be able to process protein effectively, leading to muscle wasting and a noticeable decline in strength. This loss of strength isn't just about physical limitations. It increases the risk of falls, weakens the immune system, and leaves the individual more vulnerable to infections. Adding to this, there are often changes in appetite. Many elderly individuals simply don't experience hunger the way they used to. Their sense of taste can diminish. Food no longer holds the same appeal, and they might start skipping meals or eating significantly smaller portions. This isn't merely a matter of preference, it's a physiological shift. The body, sensing that it's beginning to shut down, no longer sends the same signals to the brain to seek out food. The result is less energy, decreased strength, and a gradual decline in overall health. And we can't ignore the role of underlying medical conditions. Weight loss is a frequent symptom of chronic diseases like cancer, heart failure, and kidney disease, all of which can progress silently for a long time before more obvious symptoms appear. Even conditions like depression or cognitive decline can lead to a reduced desire to eat, creating a downward spiral where the body doesn't receive the necessary fuel to sustain itself. I recall a family I worked with, the Millers. Their father, a robust man who loved his wife's cooking, started leaving more and more food on his plate. They tried everything: his favorite dishes, protein shakes, gentle encouragement. But the weight kept dropping. It wasn't until his doctor ran further tests that they discovered a hidden tumor. In hindsight, that loss of appetite, that gradual wasting away, was one of the body's first whispers. When faced with this, families often try to solve the problem by urging their loved ones to eat more, offering favorite foods, or supplementing meals with protein drinks. But if the weight continues to decrease despite these efforts, it's crucial to recognize that the issue transcends diet. It's the body preparing for a deeper transition. At this stage, forcing large meals may not be helpful. Instead, focusing on comfort, easy-to-eat foods, and ensuring adequate hydration can make a significant difference in maintaining their quality of life. If you observe significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or showing less interest in their usual activities, please pay close attention. This isn't just about physical appearance. It's about the body sending a message. Understanding that message now allows you to prepare for the journey ahead with clarity, compassion, and the ability to make every remaining moment meaningful. 2. Extreme fatigue and weakness. When energy ebbs away. Another profound change I've witnessed time and again in the year leading up to the end of life is a deep, persistent fatigue that no amount of rest can alleviate. It's not the usual tiredness after a busy day. It's a profound exhaustion that makes even the simplest tasks feel overwhelming. Getting out of bed becomes a challenge. Walking across a room requires immense effort, and activities that were once routine, like cooking, dressing, or even engaging in a conversation, start to feel utterly draining. This isn't just the result of aging. It's a sign that the body is conserving its remaining energy as organ function begins to slow down. As the body begins to conserve its remaining energy, organ functions slow down. The heart doesn't pump blood as efficiently, circulation weakens, and muscles don't receive the same level of oxygen they once did. This is why many elderly individuals in their final months feel weak, unsteady, and unable to maintain the same level of activity they once enjoyed. A key factor here is metabolic slowdown. The body is designed to produce and utilize energy, but as it prepares for its final phase, that energy is redirected. Instead of fueling movement and activity, the body shifts towards preservation. This is why someone in decline might start sleeping more, needing longer naps during the day, and finding it increasingly difficult to stay awake for extended periods. Some might even experience sudden drops in energy, appearing fine one moment and completely drained the next. I remember Mrs. Henderson, a vibrant woman who led her book club for years. In her late 80s, she started canceling meetings, something utterly out of character. Her daughter told me, "Mom just says she's tired, but it's not like her usual tiredness. It's like her battery has run out." That's precisely what it is, the body's battery winding down. But perhaps the most heartbreaking aspect of this process is the emotional toll of this extreme fatigue. Many seniors who once took pride in their independence begin to feel frustrated, even embarrassed, that they can't do what they used to. They may withdraw from conversations, avoid social interactions, or stop engaging in hobbies, not because they no longer care, but because they simply lack the energy. This can create a cycle of isolation where they stop trying altogether, which only accelerates their decline. For families, watching a loved one transition from being active and engaged to exhausted and withdrawn can be incredibly painful. It's easy to mistakenly assume they're simply being lazy or that they need to push through it. But the reality is that forcing activity won't help. What matters most is understanding their limitations, allowing them to rest when they need to, and making their remaining days as comfortable as possible. If you notice a loved one experiencing deep, ongoing fatigue that isn't relieved by rest, take it as a significant sign that their body is undergoing a major transition. This is a time to cherish quiet moments, engage in gentle conversations, and offer support without placing excessive demands on them. Because in the end, what matters most isn't how much they can do, it's that they feel loved, understood, and at peace. 3. Increased cognitive confusion or withdrawal, the mind's fading light. As a person approaches the final stage of life, one of the most noticeable and often distressing changes can be observed in how they think, communicate, and interact with the world around them. You might notice that someone who was once sharp and engaged starts to forget things more frequently, struggles to follow conversations, or seems disoriented even in familiar places. They may repeat themselves, forget names, or lose track of time, even if they've never had memory issues before. These subtle cognitive changes can manifest months or even a full year before death. This isn't just everyday forgetfulness. The brain, like any other organ, requires a constant supply of oxygen and nutrients to function correctly. But as circulation weakens and the oxygen supply to the brain decreases, cognitive function begins to decline. The person may become easily confused, have difficulty making decisions, or struggle to recognize people and places they've known for years. In some cases, they might experience brief moments of lucidity, followed by sudden episodes of confusion, almost as if their mind is fading in and out. I've seen this countless times. A bright, articulate woman who always had a story to tell, suddenly struggling to find the right words, or forgetting where she was in the middle of a sentence. It's as if the threads of their thoughts are becoming tangled. Another common sign is emotional and social withdrawal. Someone nearing the end of their life often loses interest in social interactions. You might notice them speaking less, engaging less, or spending long periods simply sitting in silence. It's not that they no longer care about their loved ones. It's that their brain no longer processes emotions and engagement in the same way. Conversations become tiring, loud environments feel overwhelming, and eventually, many seniors retreat into their own inner world. You might also observe changes in their mood and behavior. Some individuals become more irritable, anxious, or easily frustrated. Others seem unusually calm, detached, or indifferent to things that once held great importance for them. This isn't simply a personality shift. It's often a consequence of the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express, and the person may stop reacting to situations in the ways they used to. For family members, this stage can be particularly challenging. Witnessing a loved one lose touch with reality or withdraw emotionally can feel like losing them before they're physically gone. But it's crucial to remember that this isn't something they can control. Instead of trying to force them back into conversations or activities, the most compassionate approach is to meet them where they are. Speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence, your love, and your comfort. If a loved one is becoming more forgetful, more confused, or less engaged, please don't ignore it. These are often early signs that the body and mind are preparing for the final transition. This is a time to be patient, to cherish quiet moments, and to focus on creating an environment that feels safe, familiar, and peaceful. Because even when words begin to fade, love and comfort can still be profoundly felt. 4. Frequent infections and slow healing, the body's weakened defense. As the body begins to wind down, one of the clearest physical signs is a weakened immune system. You might notice that someone who rarely got sick before now seems to catch every cold, every flu, every minor infection that circulates. What used to be minor illnesses now require much longer recovery times, and simple wounds, like a small cut or bruise, heal at a noticeably slower rate. These changes aren't random. They're signs that the body is no longer able to defend and repair itself as effectively as it once did. One of the greatest concerns is the increased frequency of infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as the immune system weakens. Many families tend to view these as isolated illnesses, but when they start occurring frequently or take an extended time to clear up, it's often a sign that the body is losing its ability to fight back. Even antibiotics, which once worked quickly and effectively, may seem less potent. The person might require stronger medications, longer recovery periods, or multiple rounds of treatment for infections that previously would have been considered minor. This happens because, as circulation slows and organ function declines, the body simply doesn't respond to treatment as well as it used to. Another often overlooked issue is the problem of chronic wounds. If you observe that small scratches, sores, or bruises aren't healing properly or keep reopening, it could indicate compromised circulation. Poor blood flow means that oxygen and essential nutrients aren't reaching the skin and tissues efficiently, making the healing process much slower than usual. Pressure sores, particularly for those with limited mobility, become a significant risk and can lead to dangerous infections if not carefully managed. What's even more concerning is that infections in the final year of life often don't present in the way we typically expect. Instead of a high fever, an elderly person might simply appear more tired than usual, more confused, or less interested in eating. In fact, for seniors, a sudden decline in mental alertness is frequently the first warning sign of an infection, even before other typical symptoms manifest. This is why recognizing these subtle changes early can make a profound difference in the level of comfort and support they receive during their final stage of life. I remember Mr. Peterson, a kind old gentleman who lived in the assisted living facility where I consulted. He was always impeccably dressed and had a sharp mind. One day, the staff noticed he was unusually quiet and seemed a bit disoriented. There was no fever, no cough, no obvious signs of illness. But because the nurses were vigilant, they recognized that this change in his mental state could indicate an underlying infection. A urine test confirmed a UTI. This early detection allowed for prompt treatment and prevented a much more serious situation. For families, watching a loved one experience repeated infections can be both frustrating and heartbreaking. It's tempting to push for aggressive treatments, hoping that one more round of antibiotics or one more hospital stay will solve the problem. However, there comes a point where the focus often shifts from curing to comforting. Ensuring they stay hydrated, maintaining good hygiene and skincare, and minimizing stress on their body can contribute more to their overall well-being than another round of medication that may only prolong their suffering. 5. Major changes in breathing or circulation, the body's final rhythm. One of the most telling signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. You might observe that your loved one breathes more slowly or shallowly than before. At times, they might pause between breaths, or their breathing might become irregular, speeding up and then slowing down unexpectedly. Some individuals experience a specific breathing pattern known as Cheney-Stokes respiration, characterized by deep, rapid breaths alternating with periods of prolonged pauses. These changes can begin subtly, but over time, they tend to become more pronounced and more frequent. Another common sign is weakened circulation. You might notice that their hands, feet, or even their nose and ears start feeling cold to the touch. The skin may appear pale, bluish, or mottled, particularly around the fingers and toes. This occurs because the body is prioritizing blood flow to the vital organs, reducing circulation to the extremities. It's a clear indication that the heart is no longer pumping as strongly as it once did. Some people also experience increasing shortness of breath, even with minimal exertion. Simply sitting up, speaking, or changing positions might cause them to feel winded or out of breath. You might notice them breathing through their mouth more often, or they may suddenly need to stop and catch their breath while talking. If they were once able to walk across a room with ease, but now struggle to do so, it's a sign that their lung function may be declining. In some cases, fluid buildup in the lungs can further complicate breathing. This can lead to a persistent cough, gurgling sounds, or even a feeling of tightness in the chest. Many people mistake this for congestion from a cold, but in elderly individuals nearing the end of life, it's often a sign that the lungs are weakening. This can make lying flat uncomfortable, and they may prefer to sleep propped up on pillows or in a recliner to make breathing easier. I recall a gentleman named Mr. Evans. He was a retired teacher with a wonderful sense of humor. As his health declined, his breathing became more labored. His family initially thought he had a bad cold, but it persisted. It turned out to be fluid buildup in his lungs, a sign that his heart was weakening. The family adjusted his sleeping arrangements, using extra pillows to prop him up, which provided some comfort. For families, witnessing these changes can be frightening. It's natural to want to help, to encourage them to take deeper breaths, or to worry that something critical is happening. But in many cases, this is simply the body's natural way of slowing down. There may not always be a way to reverse these changes, but there are ways to make them more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can help ease discomfort. In some situations, medications or oxygen therapy can provide relief, but the primary focus shifts towards comfort rather than attempting to fix the underlying issue. If you observe these signs, changes in breathing patterns, cold hands and feet, or a bluish tint to the skin, pay close attention. These are often indicators that the body is conserving energy and that circulation is slowing down. It's a time to be fully present, offer reassurance, and create a peaceful environment where they feel safe and at ease. In these final months or weeks, the most important thing you can offer them isn't aggressive medical intervention. It's comfort, dignity, and the profound knowledge that they are not alone. As we reach the end of this discussion, I urge you to take a moment to reflect on what we've explored together. Significant weight loss, extreme fatigue, increased cognitive confusion or withdrawal, frequent infections and slow healing, and major changes in breathing and circulation. These 5 signs often appear in the year leading up to an elderly person's passing. They might not all occur simultaneously, and they might not always be immediately obvious. But when you begin to notice them, it's a signal that the body is preparing for its final transition. For many families, these changes can be incredibly difficult to accept. It's a natural human instinct to want to fight against them, to encourage a loved one to eat more, move more, or push through the exhaustion. But sometimes, the most compassionate and loving thing we can do is to listen deeply to what their body is telling us. Instead of focusing solely on trying to reverse the inevitable, we can shift our focus towards making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about fearing death, it's about being better prepared for it. When you recognize these changes early, you can provide more informed and compassionate care, make important decisions ahead of time, and ensure that your loved one's final months are filled with love, dignity, and respect. This is a time for cherishing simple moments, sharing stories, expressing gratitude, and letting them know in every possible way that they are deeply valued and not alone. If you're noticing these signs in someone close to you, please take a deep breath and remember, you are not alone in this journey. Many families have walked this path before, and while it's never easy, knowing what to expect can help you find strength, patience, and a sense of peace amidst the challenges. Thank you for allowing me to share this important information with you today. It's my hope that it provides you with guidance, comfort, and a renewed sense of purpose as you navigate this delicate and sacred time.